Only in America.
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 This week, a doctor in Appalachia explains how COVID-19 is impacting his community and how immigrants working in the healthcare sector are helping.
As a senior healthcare executive, Ali, I can tell you, I shudder to even think of what would even happen if we did not have these selfless, wonderful physicians not serving on the front lines of our very impoverished rural communities with higher rates of unemployment and higher than usual rate of chronic disease burden.
From the National Immigration Forum, I'm Ali Nurani, and this is Only in America. Even before COVID-19, our nation was facing a shortage of healthcare workers, a shortage that is projected to grow. Now, fortunately, immigrants have stepped in to meet this critical need. Currently, immigrants represent 17% of all workers in healthcare occupations in the U.S. Now, most of the media around the COVID-19 healthcare response has focused, rightfully, on the large metropolitan regions of the country. Every day we see stories of Americans, born here or not, working side by side to help city residents beat the disease. But as the pandemic moves into rural America, we quickly realize that in both medical and non-medical roles, immigrants continue to have an outsized impact. Quite frankly, the healthcare inequalities we've seen in urban America are just as significant in rural America. And in both settings, immigrants play a crucial role in providing care. Many of these immigrant healthcare workers are now putting their lives on the line working on the pandemic response. Yet, there's still no easy path for them to remain in the U.S. Without a modernized visa system that allows more medical professionals and their families to immigrate to and remain in the United States, the healthcare labor shortage is only going to worsen. And Americans, especially those in rural and small-town areas, will feel the pain. As they risk their own health responding to this pandemic, medical professionals on the front lines should not have to worry about their visas expiring, and they should not have to worry about being unable to reunite with their families. Look, thanking these immigrant health heroes just is not enough. We need real policy changes to protect legal immigration and ensure immigrant professionals can continue caring for our communities.
Support for the National Immigration Forum comes from the Carnegie Corporation of New York, supporting innovations in education, democratic engagement, and strengthening international peace and security. And from Humanity United. When humanity is united, we can bring a powerful force for human dignity.
Dr. Amit Vashist knows firsthand just how critical a role immigrants play in keeping our nation healthy. As Senior Vice President and Chief Clinical Officer at Ballad Health in Johnson City, Tennessee, Dr. Vashist ensures the Ballad healthcare system's quality and safety across the region, from Kentucky to Virginia to Tennessee to North Carolina. He's also a member of the Public Policy Committee at the Society of Hospital Medicine. Born and raised in India, Dr. Vashist came to the U.S. as a graduate student in 2002. He now works to serve a historically underserved area of Appalachia, an area with disproportionately high number of immigrants filling critical workforce vacancies. Dr. Vashist has direct experience with our country's complex and challenging legal immigration system and how it impacts the broader community in Appalachia, and how the COVID-19 pandemic has only intensified the need for reform. Dr. Vashist and I spoke about the challenges of ensuring healthcare access in rural areas and why removing immigration barriers is a critical part of the solution. Dr. Vashist, thank you so much for joining. I really, really appreciate the time. Thank you.
Ali, thank you so much. I would like to thank you as well as the National Immigration Forum for having me over here and giving me a valuable opportunity to represent the tens of thousands of physicians, nurses, and other healthcare workers who have been so bravely serving on the front lines of fighting this COVID-19 pandemic.
Well, I just have to say right from the top, I struggle to find the right words these days. It's beyond courage. It's beyond heroism. It's just this passion and commitment to caring for others that you see every single day across the country from the entirety of the healthcare workforce. It's awe-inspiring.
I couldn't agree with you more. Some of the stories we knew, healthcare workforce all across the country and across the globe had a resilience and grit tattooed on it. But some of the stories and tales that we have heard just bring forth the perspective and some of the lessons from humanity that we can all learn and imbibe.
Absolutely. Well, before we get into the issue, tell me a little bit about yourself. How do you find yourself where you are now? How did you get to Johnson City, Tennessee?
Yes, Ali, I came to the United States back in 2002. Initially came to the Dallas-Fort Worth area as a graduate student. And subsequently, over the years, I wrote my United States medical licensing exams and was chosen to pursue a residency in a combined internal medicine psychiatry residency program here at East Tennessee State University's Quillen College of Medicine based in Johnson City, Tennessee. Subsequently, I converted myself to a work visa and then I became dual boarded after residency, both in internal medicine and psychiatry. I did my master's in business administration as well. And over the course of my career, Ali, I've progressively assumed increasingly complex healthcare leadership role. And at present, I serve as their senior vice president and chief clinical officer for Ballad Health. We are an integrated 21 hospital health system. We serve 29 counties across Northeast Tennessee, Southwest Virginia, Western North Carolina, and Eastern Kentucky. And as the chief clinical officer of the organization, my role is basically focused on imparting clinical quality and safety while reducing costs of care that are so important to our patient and our community. I'm also in charge of performance improvement, leveraging clinical innovation, as well as oversight of our healthcare organization's clinical delivery of care. At the very same time, I'm proud to say, Ali, that I continue to serve on the front lines as a hospital physician who is in charge of taking care of hospitalized patients.
And where did you grow up?
I grew up in India, and that's where I did my medical school in India as well. And subsequently, I immigrated to the United States.
And tell me a little bit about the, what do you say, 29 counties that the system covers. Are they rural counties, urban, suburban? Is it a mix?
Yeah, so we are in a part of the country, of course, it's the South, it is the Southern Appalachia, predominantly rural communities, predominantly healthcare underserved areas, a very challenging area of the country in terms of carrying a higher than usual burden of chronic diseases like obesity, diabetes mellitus, heart failure, kidney disease. Also, sometimes we have been unfortunately called ground zero for substance abuse, especially with the opiate epidemic. So that's the part of country that I serve.
And it's such an important part of the country writ large because, oftentimes these are the most underserved communities in terms of access to healthcare.
Absolutely. That's a great point, Ali. And over the years, we have faced our challenges. Of course, this population, in our area, what we have seen is declining population growth. Not many employers want to move here. So we have a poor payer mix. And it just leads to a vicious cycle of one disease state to another. And as a result, recruitment of healthcare workers becomes especially challenging. People, in my line of business, for example, people who graduate from our local and regional medical schools, we find it hard to recruit them because there is a desire to serve in maybe bigger cities where there is a better payer mix, so to speak, as well as better opportunities for what people perceive as a improved work-life integration.
Mm-hmm.
So
And when you look at the healthcare workforce writ large, 17% of the healthcare workforce is foreign born, 21% of doctors are foreign born, and 24% of direct care workers are foreign born. Now, do those national numbers, how do they match up with what you see at Ballad Health?
That's a great question, Ali. As you mentioned those numbers in terms of percentages. If you look at the real context, basically in the United States, 1 in 4 docs here
Yep.
in this country is an immigrant, and 1 in 6 nurses, they say, is immigrant. And this part of Appalachia, of course, we see a higher proportion of some of these immigrant healthcare force workers just because recruitment and then retention is always the challenge. By virtue of visa rules, all those kind of immigration stipulations, we do see a higher than usual proportion of immigrant healthcare workers coming to serve in these areas. But more importantly, once they come, they look at the life, the quality of life, the cost of living, all those kind of things, and they choose to make this place their home.
I mean, like I told you before we hit record, I found myself driving through Johnson City last summer and I was like, hey, you know what? This could work out.
That's true. It's a beautiful part of the country.
It really is. It really is. So tell me a little bit more about the visa restrictions and the challenges that the foreign born healthcare workforce faces.
Yeah, before I get into that, I just like to summarize. Of
Yep.
course, COVID-19 pandemic has laid bare some of these inequalities in different regions of the United States in terms of healthcare facilities and availability of healthcare modalities to our communities and our population. But I'll tell you, even before this, we have had this perennial discussion all across healthcare in the United States. And you may have come across those numbers that I have, which is that by 2030, we project a shortage of over 100,000 physicians in the United States. Now, immigrant physicians have historically, and they will continue to be a great resource to fill in this shortage over the years. What we also need to realize is that more often than not, you have these immigrant physicians. I was one of them, and I still am one of them, who are serving in these small, rural, and underserved areas of the country where it's virtually impossible, as I said, to recruit and retain docs who graduated from local and regional medical schools. In fact, I'd like to give you an example from my health system, Ali,
Hmm.
where we have a small rural town in Southwest Virginia where the only cardiologist, the only heart doctor, and both the intensive care unit doctors are immigrant physicians. Understandably, all of them are serving right now on the front lines of the COVID 19 pandemic. And my question is, can you imagine what a devastating impact it would have on that town, that community, and that hospital if some or all of these physicians, these doctors, chose to leave that area, either willingly or under unfortunate circumstances? You know, I can also say there are scores of hospitalist physicians, critical care docs who work in our healthcare system. They are on the front lines of the COVID 19 fight. As a senior healthcare executive, Ali, I can tell you, I shudder to even think of what would even happen if we did not have these selfless, wonderful physicians not serving on the front lines of our very impoverished rural communities with higher rates of unemployment and a higher than usual rate of chronic disease burden.
And then, so for those physicians, what can life be like for them when they're on the front lines of the COVID-19 response, but then perhaps for some of them or people in similar situations or playing similar roles that, they go home and look at the mailbox and are wondering if their visa application is going to come back with the right news. I mean, what kind of a pressure must that be for not just the physician, but for their families?
That's a great question, Ali. And that is also a very personal question for someone who not so long ago was sailing in the same boat. Things like, is my visa going to be renewed? If so, for how long? And eventually making decisions, life changing decisions based on your visa status. Should I buy a home? Would I be in a position to visit my home country, my parents, without fear of not returning back should something happen on the visa interview in my home country where I'm going to get my visa renewed? All those kind of considerations have a very, very real time impact on the way we function day to day as immigrant healthcare workers. Now, Visa restrictions have, I'll give you example of the COVID-19 pandemic. What has happened? We have had pockets, parts of the country within our health system also that have borne the brunt of the disease more so than others. Now you have physicians, immigrant physicians who are on an H-1B visa. By virtue of the stipulations of their visa, they're tied to a facility or a group of facilities. What happens when COVID-19 pandemic runs through a particular hospital? That healthcare workforce in that hospital gets sick or quarantined or something other unfortunate happens. These physicians in some other hospitals are raising their hands. This has happened. This has
Hmm.
happened in our health systems and other health systems as well. They want to raise their hands. They want to come and help, but their hands are tied because of visa restrictions. These are the very same physicians who have trained in the United States in some of our best institutions, and in spite of that, they are unfortunately unable to provide care. Another worry that weighs heavily on the minds of these physicians, the foreign doctors, immigrant doctors on the front line of the pandemic in America is what will happen to them while fighting the COVID-19 pandemic if they were to get sick while doing their job? What happened if they, God forbid, died? More than likely, based on their visa, it would simply mean, and that's a harsh statement, that because of their visa status, their families or they will be forced to return to their country or worse, get deported back to the country of their origin. I've had some very personal talks with physicians within my health system, and they have expressed this worry more often than not to me.
That's that. I'm sorry. I have to pause because we often hear a similar story from police chiefs or sheriffs or folks in the military who are serving with immigrants, and they are a different type of first responder, and they very much have the same fear. But I'd never thought about this in the context of that H-1B family.
Yeah, absolutely.
It's terrifying.
When we talk about the immigrant workforce in healthcare, Ali, we are not just talking about doctors and nurses. That
Right.
those are the two professions that often come to mind, are serving on the front lines of the COVID-19 pandemic. I would say healthcare workers are spanning all the way from our doctors, nurses, pharmacists, physical therapists, respiratory therapists, your environmental services workers, folks who are working in your hospital's kitchens, the cafeteria, etc., so on and so forth. They are putting themselves in harm's way as much as anybody else, and each one of them has a very critical role to play in battling this pandemic and taking care of our communities at the same time. What is also pretty appalling and strikes me as almost unacceptable is if we have followed the news, it's almost ironic. The governors of the states of New York and California, they did a few things. They enabled medical students to graduate early so that they could take care of these patients as soon as possible. They pulled doctors out of retirement across the United States. States are allowing doctors to cross state lines without receiving a corresponding, state license.
Hmm.
Whereas the fact, Ali, is that at this very moment, we have tens of thousands of these immigrant physicians who have trained and practiced in the United States. They are on top of their license and they're ready to serve in those much needed areas at a moment's notice if it were not for the crippling visa.
So, in this crisis, do you think that whether it's a policymaker, a member of the press, or even the member of the public, that people are beginning to understand the contributions of the immigrant to the healthcare workforce, from environmental services to the physician?
I think we are not, the simple answer is I think there is a better understanding now because this situation has erupted at once and it has laid bare the inequalities and the realities confronting some of these immigrant healthcare workers. I do feel that the country is still very polarized, that we are not in a full acceptance mode of the true contributions that these wonderful folks are making to our society. We're getting there, but we're not there as yet.
And I mean, particularly in just like a physically beautiful region that you're in, northern Tennessee, southern Virginia, upstate North Carolina, Kentucky. I mean, that is such a gorgeous part of the country that I don't think quite understands the importance of the role of the immigrant in providing healthcare.
I think our community has been truly thankful and grateful. And truly, as a society, we have come a long way into accepting immigrants as a part of life, especially in healthcare. The United States is, was, and will always be a country of immigrants. However, what we are talking about, Ali, is mere support and pure sentiments are not going to cut the ice over here.
Mhm.
We need some real policy actions.
And along
If
those
you
lines,
know,
what,
yeah.
what are you seeing in Congress that is promising?
Well, Ali, we have had, I'll talk about doctors. We have had tens of thousands of physicians who have endured wait times of over a decade to obtain a permanent residency status. I waited for my permanent residency for over 8 years before I decided to do some things that elevated me to a higher category of green card called the aliens of extraordinary ability. And fortunately, I was able to get that and bypass the longer line. But doctors, by virtue of what they do, each and every one of them is extraordinary. So I shouldn't have had to do that. I did it. Fortunately, I have my permanent residency, all those things. But tens of thousands of my physician brethren and sisters, they don't. But they do need to be recognized for that. And they do need the permanent residency as soon as possible. What I'll say is, that quite a few things are happening right now. I also, when I'm speaking with you, I'm also speaking, of course, I'm the chief clinical officer for my health system, but I'm also a proud member of the Society of Hospital Medicine that represents 65,000 physicians who practice on hospitalized patients across the United States, and I'm a member of their public policy committee. So we sent a letter, the Society of Hospital Medicine sent a letter on April 1st to our lawmakers on the Capitol Hill. We advocated for quite a few changes, Ali. Some of them have already been enacted or are in the process of being enacted by the United States Citizenship and Immigration Services. So in summary, what we had advocated and recommended for was things like electronic filing for H-1B visas for physicians, premium processing for folks for immediate and automatic renewal of H-1B visas, a year-long extension for physicians and healthcare workers on H-1B visas, increasing the available, this was important, increasing the available number of J-1 waiver slots for physicians to serve in rural underserved areas of the country. Currently, the J-1 waiver slots, Ali, are capped at 30 per state. However, we need
Really?
many more. We need many more than that to serve and improve healthcare outcomes to our rural communities. We also strongly urge our lawmakers to grant these more than 10,000 United States physicians stuck in the green card backlog immediate permanent residency so that we can boost the flexibility of the healthcare workforce and give these providers and their families the peace of mind while they selflessly put themselves at risk in caring for our communities. Thankfully, as a result of some of our efforts and countless other stakeholders like yours, the National Immigration Forum, American Hospital Association, etc., a bipartisan group of senators, Senators Perdue, Dick Durbin, Young, and Coons, they are introducing what is called the Healthcare Workforce Resilience Act, which seeks to utilize these unused visas, which are about 15,000 for our doctors, 25,000 for our nurses, so that they can be used to issue permanent residence that is fighting the COVID-19 pandemic. And this is what truly enthuses me, excites me, and energizes me, all these kind of developments that have been overdue for so long, Ali.
It has been great to see the bipartisan leadership on that Resilience Act. It has been quite amazing. Do you have any, to your knowledge, any DACA recipients as part of the system at Ballard?
I am not really sure. That's a great question, Ali. I'm sure there will be quite a few. As far as numbers are concerned, I do not have an estimate of that.
Yeah, when you look at the nationally, I think 29,000 DACA recipients are in the healthcare workforce, and I have to imagine a number of them are serving, rural and suburban healthcare systems like yours.
Absolutely. And we do have a representation from the Hispanic community and folks from Central American countries. So I will not be surprised if we have a sizable population of DACA recipients.
So, in your role at Ballard, what keeps you up at night these days?
Quite a few things.
Yeah, I can imagine.
Yeah, of course, I have There are some immediate worries and there are some system-wide worries. I have a spouse, my wife. She's a frontline hospitalist physician. She is actually taking care of COVID-19 patients. So, as unlike any like any other healthcare worker, we are of course worried about our own personal health, well-being. We've got two beautiful boys, so we worry if we might inadvertently expose them to the coronavirus. What also keeps us awake is some of our states in the south. We are gradually opening up our economies, and although we are taking precautions around social distancing, nothing is foolproof. So we are worried about a second wave of the COVID 19. If so, how big the second wave of the disease is going to be, and are we prepared or not? So, system wide, I think we have done a great job. Our command center is up, ready, has been functioning for the last 54, 55 days, I would think. But it definitely is a cause of concern that is perennially going through our minds. Are we prepared? If so, do we have enough PPEs, therapeutic modalities, so on and so forth?
Well, thank you not only to yourself and your wife, but to the entirety of the staff at Ballad Health for just the service and playing such a critical role, particularly in a community that has such a lack of healthcare services. But I have one last question for you, Dr. Vashist, and that's a question that I ask of everybody who's a guest. As you know, the name of the podcast is Only in America. So the last question is to finish this sentence. Only in America, ...
I would say only in America would I be accepted the way I am as a doctor and as a person in spite of my numerous shortcomings. This dream could only happen in America. That doesn't mean we're there yet. We can always do better. But my dream and the dream of so many others could play out the way it has played out only in the United States of America.
Dr. Vashist, thank you so much for the time. Thank you very much for what you do. And we are certainly looking forward to being able to partner with you and your colleagues more and more in the future. So thank you.
Thank you, Ali, and thank you so much for having me. I truly appreciate your and the National Immigration Forum's advocacy for issues that are so pertinent, so relevant, and important for our immigrant population. One last note, I'd just like to end by reiterating, that this COVID-19 pandemic is a war with an invisible enemy, and immigrant physicians and healthcare workers have been absolutely critical to providing quality care, especially on our front lines. I think it's time we remove their immigration barriers so that they can focus on the task at hand and continue the good fight. I do appreciate you having me on. Thank you.
Thank you. Dr. Amit Vashist is a Senior Vice President and Chief Clinical Officer at Ballad Health and a member of the Public Policy Committee at the Society of Hospital Medicine. You can find more information about Dr. Vashist at our website, immigrationforum.org/podcast. And while you're there, subscribe to Only in America to catch all of our latest episodes. Tune in next week for the second installment of Keeping Us Healthy. And remember, Only in America is produced and edited by Joanna Taylor and Megan Wetmore. I'm Ali Noorani, and I will talk to you next week.